All right, now let's look at some homeostatic imbalances of glucocorticoids, right? So what are glucocorticoids? What's an example? Cortisol, right? And so where is cortisol from? All right, so from the adrenal glands. What part of the adrenal glands? The adrenal cortex, right? And so when we talked about cortisol, what was the actual function of cortisol? You have anti-inflammatory, immunosuppressive, increased blood sugars, right? So glucocorticoid increased your blood sugar levels, degeneration of bone, etc., right? And so when we look at the actual mechanism from before of how it's being secreted, you have a hormone from your hypothalamus called CRH, corticotropin releasing hormone, right? Secreted from the hypothalamus that goes through the hypothalamic hypophyseal portal system, right? Goes to the corticotrophic cells and allows for the release of ACTH, adrenocorticotropic hormone. Adrenocorticotropic hormone now enters the bloodstream, right? Comes into the bloodstream, binds to the region of the adrenal cortex, zona fasciculata, and you have the release of glucocorticoids, specifically cortisol, right? And so if you remember before, so if I would label these where each of these are, so you have, let's put this in pink, so you have the hypothalamus, anterior pituitary, and the adrenal cortex. So I'll just put adrenal gland. Let's just put cortex here, all right? Now, and we said before this was regulated via negative feedback loop, right? So what does that mean? When the stimulus, and the stimulus is cortisol, becomes present, this causes an inhibition, right? So when this cortisol levels go up really high, this can cause an inhibition. And so when you have homeostatic imbalances, when we talked about before, we have hypersecretions and hyposecretions, right? So hypersecretion means what? Hypersecretions means you make too much. And what is hyposecretions? Too little. So an example of a hyposecretion, we talk about the homeostatic imbalances of cortisol, right, is a disease called Cushing's disease. So Cushing's disease can be a result of multiple things. This disease is due to either again, the end goal of Cushing's disease is increased level of cortisol in your body. So you have excessive cortisol being secreted. This can be a result of a pituitary tumor in the anterior pituitary. You have a tumor that's usually benign that can put a lot of pressure on the ACTH, and the ACTH begins to hypersecrete constantly, and it is not regulated via this negative feedback loop, right? So you can have the anterior pituitary be effective, and also there's certain kinds of adrenal tumors, right, that come in and actually put pressure, and even though this negative feedback loop is not generated, this pressure causes this differences. And so when you look at these different mechanisms of where it is, when it affects specifically the adrenal glands, specifically, we call this a primary hypersecretion, versus when it affects the anterior pituitary or even the hypothalamus, we call this secondary responses, right? And Cushing's disease is, again, like I said, a hypersecretion of cortisol, right? And so these patients exhibit, excessive levels of anti-inflammatory effects. Their immune systems become compromised, right? This can lead to certain cardiovascular problems. The vascular system can be inhibited because of this excessive secretion of cortisol. Neural defects. What else you can have? You can have gastrointestinal problems. They have this phenomenon called a moon-shaped structure. So they have this oval-shaped. They have instances of edemas, right? So they have instances of building of fluid, right? And this can become problematic, right? They have, because we said, what is the function of cortisol? Cortisol is also immunosuppressant. So these patients with Cushing's disease can exhibit instances of infections, right? Infections, any kind of secondary infection like flu, cold, right? And they'd be highly susceptible to this problem, right? And even because this cortisol is a steroid hormone also. This can lead to instances of a phenomenon called gynecomastia, where the males develop breast tissue, which eventually, if properly stimulated, can actually have milk production with the help of that. What was that hormone that allows for milk production? Prolactin, right? And so these are just several examples of this. You know, they have thin skin, they have this bruising tendency because of the lack of being able to blood clot because of the lack of immune system and your blood cells, specifically your white blood cells, even your platelets become compromised, right? And then now the next thing we want to look at the hyper before, and now we're looking at hypo secretion. So what is hypo secretion? So hypo secretion means what? A decrease in cortisol level. So same mechanism could apply, right? Of how the different types we have, like primary and secondary, correct? However, rather than a stimulation of these, for example, these tumors or anything like that, this can lead due to some kind of obstruction, right? So this blockage. So even though this tumor is present, this causes a inhibition of the secretion of ACTH or an inhibition of the adrenal cortex to release the cortisol. All right, and so this condition is called Addison's disease. So Addison's disease is an example of hyposecretion of cortisol, right? So this condition usually is characterized by low cortisol, right? So these patients usually exhibit instances of excessive levels of inflammation, right? They have improper mineral balances, so their sodium levels go down. Then what else? Because we also said cortisol is a glucocorticoid, and in a time of stress when your body needs sugar, they have a difficult time of increasing their blood sugar levels, right? They have excessive levels of blood sugar level problems, right? And so this treatment how would you treat someone with Addison's disease? So you would give them cortisol. So a lot of treatments that they use for Addison's disease is supplementation of cortisol, right? Other symptoms that people experience where, perfect example is family friend has Addison's disease. This guy, you know, his brother, mom, everybody, light-skinned, blue-eyed people. He comes in, very dark complexion. And I remember this too specifically too, because I thought he just had a really good tan, because I remember one time we were going to a hike and he decides to take his pants off and moon me, right? And when he mooned me, I noticed one thing besides his bottom is he had no tan line. This was his actual color. So you're looking at a kid, blue eyes, you know, and all of the rest of his family is light skin, blue eyes, right? And so I asked, you know, his brother, does he have this condition, right? And he said, how did you know? Well, Addison's disease also, they have a tendency of having this phenomenon called a bronze pigmentation. The corticotrophic cells in the anterior pituitary secrete ACTH, but they also secrete another hormone called MSH. Let's put this in pink. MSH, melanocyte stimulating hormone, is also in the corticotrophic cells. So because there's a hyperstimulation of this ACTH, right? So you have high ACTH because there's no negative feedback loop created from the cortisol due to the lack of cortisol, either obstruction of the adrenal cortex or the anterior pituitary. These patients have not only a hypersecretion of the ACTH, because they have the same type of cell that makes the melanocytes generate melanin, right? So melanin is a protein that is created in order to absorb UV. It gives a cell the hyperpigmentation. MSH levels also increase exponentially. And so a lot of these patients exhibit this bronze-like coloration of their body, right? So they have, you know, hypotension because of this. We talked about the low mineral levels. They have weight loss. They could lose weight really easily. Again, GI disturbances, very weakness, very frail. And this can be, so if I were to ask you, you know, is Addison's disease or Cushing's disease, are these dangerous? Of course they are, right? These conditions are very dangerous. And so these conditions need to be taken very seriously and addressed accordingly based off of treatment, right? So for Cushing's disease, you want to bring the cortisol levels down, not to zero, right? Because you want to make cortisol. And then the hyposecretion, when we talk about Addison's disease, you want to bring the cortisol levels back up, right? So these hormones are constantly at this homeostatic balance at a certain level, certain concentration. You know, they keep going up and down, up and down. But if eventually you have a excessive or a small amount, right, this can lead to a lot of problems down the line if not treated. And it can eventually become a life-threatening condition. So it needs to be treated immediately.